Heart failure is a major healthcare burden in the 21st century due to its rising prevalence and complex management challenges. Heart failure affects about 2% of the adult population in developed countries and over 10% of individuals over 70. Global prevalence is 26 million and is expected to rise dramatically as the population ages. Mortality in heart failure is high throughout the world. More than 26% of patients die within 1 year of diagnosis. 50% die within 5 years. Heart failure is a complex chronic condition characterized by abnormality in cardiac structure or function that lead to systemic perfusion inadequate to meet metabolic demands, interspersed with acute episodes that contribute to further deteriorate organ function. Heart failure with a left ventricular ejection fraction less than 40% is referred to as heart failure with reduced ejection fraction. Characteristics include dilatation and thinning of the left ventricle, reduction of cardiac contractility, and increased end diastolic and end systolic volumes. Half of all heart failure patients have ejection fractions greater than 50%. This syndrome is referred to as heart failure with preserved ejection fraction. The principal abnormality is increased left ventricular wall stiffness with thickened walls and decreased compliance. No treatment has yet been shown to reduce mortality in heart failure with preserved ejection fraction. Heart failure develops in response to a triggering cardiac event that impairs cardiac performance. This leads to a reduction in cardiac output, arterial pressure, and tissue perfusion. To compensate, the body activates 3 main neurohormonal pathways: the sympathetic nervous system, the renin-angiotensin-aldosterone system, and the natriuretic peptide system. Persistent overactivation of the renin-angiotensin-aldosterone system and sympathetic nervous system leads to unfavorable cardiovascular effects, including systemic vasoconstriction, sodium and water retention, increased ventricular pre- and afterload, ischemia, and myocardial hypertrophy. Natriuretic peptides are released from cardiac myocytes in response to myocardial wall stress. The natriuretic peptide system opposes the activity of the RAS and sympathetic nervous system, and its effects include vasodilation, diuresis and natriuresis, decreased aldosterone, antifibrotic effects, and antiproliferative effects. Natriuretic peptides are degraded by the enzyme neprilysin, which breaks down natriuretic peptides into inactive fragments. Neprilysin is widely expressed in tissue cell membranes and is responsible for the degradation of several vasoactive peptides.